Hello, everybody, and welcome to Reopening Alabama, a mayoral town hall series presented by AARP of Alabama. I'm your host, Ivana Hrynkiw, and today we are joined by the Birmingham Mayor, Mr. Mayor Randall Woodfin. Thank you so much, Mr. Mayor, for joining us today. We know you're very busy.
Hey, good morning. Thank you for having me, and thank you for hosting the series. Happy to be a part of it.
Yes, sir. Well, we have a lot of questions for you. We hope to get some people on to ask you directly, but I think the weather has got a lot of our participants sleeping in. So I think you're stuck with me. But we have a lot of good questions. So let's just get on into it. We're going to start out with one that is kind of a compilation of a lot of questions that we have received, and I'm sure that you have received as well. This is from Justin, and he asks, with the COVID cases rising, do you think it'll be a good idea to close businesses again? And are you considering a curfew?
The answer is no. I don't. I do not think it would be a good idea to close everything now. Um, you know, I want to go back to March because the question is really important. The second part of the question is curfews. Let me answer that. Let me answer the questions. No, I don't think it would be a great idea to close um, and shut down the economy right now. And two, no, I don't. I do not think we should implement a curfew. So now let me explain why I believe that. You go back to March, every decision we made, every decision I made was through the lens of saving lives. And so shutting down our economy then made total sense because we were dealing with something that was not only spreading, but it was actually killing people. And we wanted to save lives. And so the curfew made sense. The health department shutting down certain businesses made sense. I think as we've moved through this in March, moved through April, moved through May, now in June, and now literally going into July, we do have to strike a balance. It's extremely important to strike a balance between saving lives and saving livelihoods. Those two things are not the same, but I do believe you can do both. Now, saving lives means that, you know, probably many months ago when when the restrictions were lifted, the entire state should have moved towards wearing facial covers. And it's not about personal rights. It's more about what's best for the community and saving lives. And so I think there you could strike a balance between opening up the economy and how people engage when they leave their homes. One of the best ways to do that is social distancing and facial covers. But we didn't do that. We now moved to where we are now. Even in a city like Birmingham, we had 87 cases yesterday. And our numbers are such at a point where states like New York and New Jersey have us on the list and don't even want us to travel to their states. And if we do need to quarantine, that's because what we've done, unfortunately, in many parts of the state, elected officials have done more talking than the actual health experts. And I think the elected officials at this point need to get back to listening to the health experts because they are making suggestions to us that we should take.
You know, you were I think it's fair to say you were pretty ahead of the curve, especially in Alabama, on implementing a mask ordinance and encouraging that mask ordinance for other parts of the state. Now, we have to look, though, at Birmingham does have this ordinance, but there are people like myself who live in the city limits of Birmingham, but often go into maybe parts of Homewood, Mountain Brook, Vestavia, other surrounding municipalities for daily activities or weekly activities. And if those cities and those areas are not requiring mask ordinances, do you think that it still matters for the city limits of Birmingham if people coming in and out are still going to be exposed to the virus just a few blocks away?
Yes, the answer is yes. It does matter for the city of Birmingham. The reason it matters is because I understand that mayors have geographical lines as it relates to where our cities start and stop, but the coronavirus doesn't respect that. There are no geographical lines for this virus. This pandemic knows no bounds across the entire globe. It has the possibility and has killed not just people globally, not just here in America, but right here in Alabama and even here in Jefferson County. And I think it is a slippery slope for residents to talk about facial covers and then attach it to this whole notion of my rights, my liberty, my freedom. You're missing the point. The point is this is your community. You have an opportunity when you walk out of your home to make sure either you don't get it and more importantly, you don't spread it. And I would like for people to move away from this selfish notion of me, and I. And the coronavirus, in order to beat this, you have to embrace the notion of we, us, our. And wearing facial covers is more of a community effort for us to protect each other than it is about you, the individual.
That's a good point. And just so we note it for today, according to the Alabama Department of Public Health, there have been 1,129 new cases added to the state's list today. So just to add that in there. Now we've got another question regarding COVID and some of those business closures. We've got a question from Twitter, and this says, will the city be prepared for the shortfall in revenue this year that has been caused by COVID-19?
We are actively working through that now. Our new budget every year is supposed to start July 1. But because of the projected shortfalls that we don't have the hard number yet, we've asked our council, and our council has approved for us to submit our budget starting October 1, which means we will get them a projected budget for them to discuss and debate and go back and forth with by August of this year. And so over the next 7 weeks, we will be addressing how do we solve for our shortfalls. But yes, a city like Birmingham is heavily dependent on business license, which those business licenses offer in the form of occupational taxes for those employees, as well as the customers with sales taxes. And because people aren't having any events in our city, we're also facing a shortfall as it relates to our lodging taxes. So when you combine the business license, sales taxes, occupational taxes, as well as lodging taxes, we are embracing ourselves for a shortfall. How to solve for that shortfall, because 70% of every dollar goes to employees.
Is that going to cause some heartache for you and for your counselors to decide what of these agencies and boards are going to be receiving significantly less funds from the city going forward?
The heartache has already started, my friend. I would tell you that, across the board, tough decisions will have to be made. I have to strike a balance between keeping employees employed, as well as providing basic services, as well as how do we solve for the boards and agencies that we have contractual relationships with versus the ones we would just like to give additional support to. So all these things are taken into account, but everyone will receive a pinch. So no one goes unscathed. There are no sacred cows in what we're doing. If our employees feel a pinch, boards and agencies who are external will also feel a pinch.
And that does kind of relate with what you announced earlier this week, that a lot of services that have been in kind and have been free to citizens are going to have to pay for those services going forward.
Yeah, well, the frame is this. What we want to start with is let's start over. If you've been receiving those in-kind services free for so many years, then you would assume and have an expectation automatically it's going to be free next year. What we're saying is don't have that expectation. Please consider when you draft your budget, include these services that would have been free in the past. Now we can negotiate, or we can say, yes, we can do it. No, we can't do it. But what we're saying is from an expectation standpoint, don't expect it just because you got it last year due to the coronavirus. If we can work with you, if we can offset that cost, if we can provide something free, we will let you know. If it can be 100% of your request, 50% of your request, or 25% of your request, that is to be determined based on us getting hard numbers of how financially hard we're hit.
We're going to shift back a little bit from the budget. We're going to answer, this is a question actually from a doctor who submitted it on Twitter. His name is Todd. And Todd asked, how do you persuade more authorities to promote universal mask usage as a way to provide safety and increase engagement with the economy?
I think the simplest answer is the three people. Dear Mark Wilson, the Jefferson County Health Officer, through your authority and power, put all the elected officials in a position to get out of the way, and you as our health director, tell us what we should be doing around facial covers. Second person is Dr. Scott Harris, the state health officer. Please encourage the governor to make the decision if we're going to get over the spread. The easiest way to do it is facial covers. And maybe the conversation shouldn't be towards people. Maybe these people should having these conversations with business owners and walk into your establishment and you and I but for the exception of eating and drinking, we should be wearing a facial cover. It's that simple. I'm actually very baffled, Todd, why facial covers is such a hard topic we're having. We're 6 weeks in post things opening and we're still talking about debating should people be wearing facial covers or not. This is actually at a point where I'm just questioning, like, why is this still a conversation? Let's make the tough, hard, unpopular decision. Let's move past the Constitution because this is probably the same Constitution people are talking about. You have to wear a seatbelt when you get in your vehicle, or you have to wear shoes when you walk into a place of business. It's the same notion, except this is actually saving people's lives. So we need to get beyond this conversation. We need to move towards facial covers until this thing slows down, because the whole idea is we don't want anybody to die. We don't want our hospitals overrun. We don't want everyone on a ventilator, and we need people to remain healthy.
Let's talk about our hospitals. Birmingham is uniquely situated. We've got at least 5 major hospitals in Birmingham. And that makes us a hub, a medical hub. And that means that people from across the state, maybe who do not have the same access to healthcare, even just logistically do not have a hospital nearby, could be coming to Birmingham for treatment. How are our hospitals and how are you prepared to help those hospitals in the event that they become overrun?
And so that's why this conversation around facial covers is so important. The last thing we want is for our hospitals to be overrun. Now, the current numbers at UAB as it relates to those who actually need a bed and or need a ventilator is at the number it was back in March. That lets you know that our numbers are out of control at this point. But it also lets you know that everybody's not asymptomatic, that certain people are getting this and it's knocking them off their feet. They either require a ventilator or they require additional help. That's not good. And that's not good for several reasons, not only for the individual who's sick, but our hospitals here in the Birmingham area, of the 1,000 ventilators across the entire state, we only have about 300 here. So although we have all of these hospitals, everyone can't come here and expect a ventilator. And if you had to choose between wearing a facial cover and a ventilator, or needing a ventilator, I think that's an easy choice. And so we have to make sure, if you are an elected official, if you are a health officer, we need to move people towards doing things that are more proactive to prevent community spread so we don't have an overrun on our hospitals. They are our first line as it relates to those who need additional care, but they can't do what they need to do if we're not doing what we need to do, which is being a community, acting as a community. And one of the best things we can do as a community right now, again, is some form of a facial cover, with certain exceptions if you walk outside of your home.
And I think I can speak for all of us at the moment by saying we do want to just use that quick second to offer a thank you to all of our healthcare workers, our doctors, nurses, everybody who works in the healthcare field. We appreciate you and what you're doing. Now, let's talk again about businesses. We got a question from Vivian, and she asks, when will concert venues be allowed to open in full capacity? And I think going along with that as well, we can talk about bars and other entertainment venues across the city.
So look, we have to talk about places that are super spreaders. We know that public elevators, public restrooms, weddings, birthday parties, funerals, choir, church, call centers are places of super spreaders. When you add on top of that, it's actually conventions. Conventions in the form of looking at convention spaces, as the BJCC, or concert halls like the Legacy Arena. These places have the potential to be super spreaders, and as of now are still too dangerous. And so I'm not sure when we can get back to having an indoor concert. I think outdoor and how you manage outdoor facilities such as a Legion field or a soccer field is different from an indoor concert, because that has the potential to be a super spreader, because people aren't going to want to wear facial covers, right? Or be 6 feet apart inside a place like that. And so I just think we have to see where the numbers are right now. And the numbers where they are right now says that many people aren't ready. Venues are not ready to host concerts or conventions. If I'm correct, even I just got an email yesterday. I think the DNC won't be in person overall because they want to decrease the number of people that are going to be in one gathering. So, as a community, we're not ready for concerts.
Now, you mentioned big gatherings, and I think that that's a good time to mention. This is a question, I believe, from Hogan. And he asks that the Alabama State Bar exam has been held in Birmingham for the past several years, and you're an attorney. And so you've been through that horrible experience. And that is being held in Birmingham this year downtown, and that is where several hundred people will gather to take that exam. Now, I know that that is a state exam, but it is being held in Birmingham. Are you worried about an event like that with several hundred people in an area being a issue for coronavirus spread, or any other event as well like that? I just use that as an example from Hogan.
The answer, Hogan, is no, and that's for a couple reasons. One, I think they're implementing several health protocols. I think the thing you have to worry about at a concert versus a group of people taking a test is talking, right? Actually using your mouth. So at a concert, you don't stand there in silence. You use your mouth in the form of talking, in the form of shouting, in the form of singing. And the particles that come out of our mouth lend itself when you don't have a facial cover on to spread to a next person, either on surface or an actual human being. I think when you're taking a test, you're a minimum of 6 feet apart, but in the space they're in, they're probably more than 6 feet apart. I imagine with certain exceptions, they should probably encourage some form of a facial cover. In addition to that, no one is actually talking, so there's less opportunity for actual particles coming out of someone's mouth. And so overall, I think those who need to take the Alabama bar should be able to continue and go forward in taking it. Just need to make sure that there are health protocols in place, such as scanning to see if anyone has taken their temperature, et cetera, before they actually walk in.
Now, and I think that, at least for me, if you are one of those people who goes to the concerts and stand there silently, I don't know if I want to go to a concert with you anyway. So, so we do have a question from our presenting sponsor, AARP of Alabama, and Candy is here to ask you that, Mr. Mayor.
Hi, Mayor. Thanks for joining us today. I have a two-part question for you. First, how have senior services been affected in Birmingham, and what is being done specifically for seniors to ensure that they are receiving what they need during this time?
Candy, that's a great question. I would tell you, senior services have had a actually negative impact. Part of the reason is because the two top places where our seniors congregate have taken the most significant hit. The first is our nursing homes, right, where some of those outside activities that can usually come have been shut down as early as March because you don't want outsiders and there's a super spread. The second place, believe it or not, Candy, is church. When you think of church and our seniors, in the Black community, it's the second largest gathering outside of nursing homes and senior facilities for our seniors. But because church hasn't been in, again, some of those services have not had a chance to be offered. So I think what a lot of people in the community have tried to do is to try to shift how to get those resources to the actual home with home visits or drop-offs. In addition to that, we've looked to do all type of drive-through programs where resources are provided. On one end, food, on the other end, getting prescription drugs to residents. And so it's just been, those aren't rocket science things, right? It's all more logistics, how to get the services directly to the seniors if the seniors can't come to you. And the top two forms of that have been either home visits or actually drive-throughs, and they've both been successful.
Thank you, Mayor.
You're welcome.
Thank you, Mayor. Now, we do have a question from one of our colleagues, and he asked about the Birmingham Promise. And he says, are the kids going off to college, and with the Birmingham Promise effort, are they going to be set back by the pandemic?
No. So we for your viewers who don't know, the Birmingham Promise is a two-part program. On one part is apprenticeships, where young people work 16 hours a week for a minimum of 16 weeks total, making $15 an hour. For as juniors and seniors. The other part of the promise is for every Birmingham graduate that attends a public 2-year, 4-year state school will be able to go tuition free. We're happy to say at least 700 plus students will be able to participate when school starts this fall at Alabama and Auburn and UAB and Alabama State and Alabama A&M and what two of the 2-year schools, which include Jeff State and Walls State, etc. Those young people, we're still working with them right now. They'll still be able to go to school tuition free, and we're still working through working with these colleges and universities on assisting with their transition.
Now, we have a question too about protesting. Now, this is from, I believe from Twitter, people may have put themselves at risk of contracting COVID due to protesting at the end of May and at the beginning of June. Did that large groups of people congregating concern you about the COVID risk?
It did. I've spoken to many mayors across the nation, the mayor of St. Paul, Minnesota. I've spoken to the mayor of Atlanta, the mayor of Columbia, South Carolina, and other mayors who've had these active large gatherings in the form of protest. And what we've all said is we are embracing for higher numbers over the last 2 weeks, which that seems to be panning out. But we know the increase in COVID cases are not just due to the actual protests. They're due to an assortment of things. More people are going to the beach, more people are going out for drinks, more people are going out eating and at parks, and more people are just in public places. So did that large gathering shock us and worry us? The answer is yes. Do we think that's going to cause additional community spread? The answer is yes.
Those are tough answers, I'm sure, for people who maybe didn't want to hear that, maybe expected it, but didn't want to hear that. Now, I know as well, I've asked every mayor that I've had on, and obviously want to ask you as well. And that is, what grade would you give Governor Kay Ivey for her handling of the pandemic and everything that has gone along with that?
Well, I'm not sure what the other mayors have said, but I'm hesitant to give her a grade because I don't want to be the judge of how she's handled the COVID-19. But I can also be honest with you without actually giving a letter grade. Do I expect or want more from our governor in a time of a crisis? The answer is absolutely yes. What I appreciate on the front end is that she had a hell of a team that she put together to make recommendations to her. The question is, as elected officials, did she take heed to all of those recommendations they made? I imagine some of those recommendations were unpopular. I would have hoped one of those recommendations would have been statewide facial cover. And I think Alabama would look different now if facial covering would have been implemented months ago. But I understand that you can't keep the economy closed forever. The question is, though, if you open it back up, how do you offset continued spread? And so would we like to see more visibility from our state leader? The answer is yes. Would we like making more decisions that are health driven instead of political driven as far as pressure of why we shouldn't do something? The answer is yes. But I think her grade is left to the people of Alabama to assess, not me.
Is it too late for her to implement a statewide mask ordinance or anything like that?
Never too late. And that would show a lot of leadership.
Got it. Well, thank you so much, Mr. Mayor, for all of your direct questions and for, unfortunately, like I said, dealing with me instead of some of our viewers today, but that's all right. So we thank all of you so much for tuning in to another installment of our Reopening Alabama series, which is presented by AARP of Alabama. Please join us next week for a town hall with the Fairhope Mayor, Mayor Karen Wilson.
Thank you. Thank you so much.